Assalamualaikum dear students, hope you are well and hearty. Welcome to NIEVS Homeschool. This is Fatema Sabrin Shikha, assistant teacher of National Ideal Immunization School, Morning. Today I am going to take home science class for the students of class 8 under topic chapter 5 discussion. Number 18. Today our topic is chapter 5 discussion. Students, this is our 9th lecture and 7th homework. So dear students, please take your textbook. We are going to read the text. So let's start. Chapter 1, name, awareness of disease. So in this chapter, we will be able to learn about some disease, and through this we will be aware of this disease. First, I'm going to start with lesson 1, common childhood disease. For lack of proper care, children can be attacked by different contagious diseases. The common causes are low birth weight, premature birth, food deficiency during prenatal period, no complementary diets after 6 months along with breastfeeding, not getting timely preventive vaccine or injection. So, there are some causes, and that's why our children used to suffer from various kinds of disease, and these are low birth weight, premature birth, food deficiency during prenatal period, no complementary diets after 6 months along with breastfeeding, not getting timely preventive vaccine or injection. So first we are going to talk about fever. Fever is common disease for all, especially for children. The normal temperature is 98.4 degree Fahrenheit of a body. We know the normal temperature of human body is 98.4 degree Fahrenheit. But there is difference between human body, that means an adult person, and in children. The temperature of a body, baby's body, is 99 degree Fahrenheit. So in compare, the normal temperature of an adult person is 98.4%, whether the temperature of a baby is 99 degree Fahrenheit. When the temperature rises above this, it is considered as fever. So for our children, if the temperature is more than 99 degree Fahrenheit, it is called fever. So the following steps should be followed for low-grade fever. If we have, or our children is suffering from low-grade fever, what we have to do? Using light cotton dress, light and airy room, washing head and sponging of the body, serving light liquid food, especially saline water, fruit juice, soup, etc. So when a baby is suffering from low-grade fever, we have to use cotton light dress for him, and we have to make arrangement for light and airy room. We have to wash the baby's head, we have to sponge the body, and we have to serve the child light liquid food containing water, fruit juice, soup, etc. And duties to be done in high fever. We are talking about low grade fever. Now it's about high fever. So what we have to do, what is our responsibilities towards our children when it is high fever? High fever is common among the children of 1 to 5 years. So the children who is belonging 1 to 5 years old, it is common disease. It may rise up to 105 degree Fahrenheit and is harmful for brain and nerve. So high fever is harmful for brain and nerve. The symptoms are, so how can we understand that a child is suffering from high fever? These are convulsion and abnormal appearance, increase in the rate of respiration and pulse, become senseless, frequent vomiting and loose motion. So these are the symptoms of high fever. So in the time of high fever, what we have to do with the children? The following steps should be taken. First, frequent sponge of the body with cold water and pouring water on head. We have to sponge the body of the children and have to pour cold water on head. Next, in high fever, a shower is necessary to bring down the temperature by 2 or 3 degrees. If the baby takes shower, the temperature may decrease from 2 to 3 degrees. Like cotton dress is necessary in this condition, and if the situation is acute, then you have to or we have to consult with our physician. Now look, what is the prevention? Liquid food is necessary as diet in fever. So in the time of fever, we have to provide liquid foods to our children. Liquid foods indicates water, saline, fruit juice, soup. That means all the liquid elements, not hard elements, is necessary in the time of fever. Now we will learn about lesson 2, the disease diarrhea. So diarrhea is a waterborne disease, and the symptoms of the disease are the following. So our children used to suffer from diarrhea, and how we can identify that the child is suffering from diarrhea? The followings are frequent loose motion, nausea or vomiting, sunken eyes, tantrums, dryness of tongue and lip, loss of weight. So if we find this type of symbols, then we can easily identify that the child is suffering from diarrhea. So what steps we have to take? So we have to take such steps, and they are continue breastfeeding with normal food. It is important for a child with normal food. Breastfeeding is must. Liquid food like fruit juice, rice, saline, etc. can be served. So our child must take normal food with breastfeeding. Hospitalized in severe dehydration. So as a child is suffering from diarrhea, and because of loose motion, a child can suffer from dehydration also. Dehydration means lack of water. Dehydration means lack of water. So if the child is in severe dehydration, we must have to hospitalize him or her. And another technique, we can serve him or saline. That means oral rehydration saline, and in short we say ORS. So to make saline, what we have to do, such ingredients are molasses or sugar, salt, pure cold water, and the quantity is molasses or sugar will be a handful, salt will be a pinch, pure cold water will be half liter or 500 ml. So with these ingredients, what we have to do, the ingredients should be mixed properly for making ORS at home. So when the condition is normal, we can make saline at home by using all these ingredients, maintaining this quantity. So how to prevent diarrhea? First, always use pure water. So our drinking water or our everyday use water must be pure water. Milk should be boiled perfectly. If we don't boil milk, then it can be harmful for our stomach and can make diarrhea. Food needs to be heated before taking. After using toilet, hands should be washed. So if we follow all these rules, we can prevent diarrhea. Now come to lesson 3, cold, cough, influenza and arm. Now first we will talk about cold and cough. So what we have to do in cold and cough? Cold and cough basically happens in the time of winter, and when in summer season, due to dryness, due to dust, it can happen. So what we have to do? Use handkerchief or tissue, gargling with hot saline water. Plenty of fluid like saline, fruit juice and others are to be taken. Take doctor's advice. So we can follow all these rules if we are suffering from cold and cough. Next, influenza. What is influenza? It is an airborne contagious viral disease. The symptoms come out within 18 to 72 hours of virus attack. So if any virus, that means influenza carrying virus attack us, we will be the symptoms will be showing within 18 to 72 hours. So what we have to do if a child or a person is affected by influenza? First, use handkerchief during sneezing and coughing. Cough and spitting everywhere should be avoided. We have to use handkerchief. It is must while sneezing and coughing, and we will avoid to spite or cough anywhere. The affected child should be kept in a separate room. Soft and liquid food is the proper diet. Cleanliness is necessary. Doctor's advice. So all these are we have to do properly in the time of influenza. And next one is worm. This is dangerous disease for children. Worms live in the intestine as parasite. There are 3 types of worms. Basically, our children used to suffer from worm. This disease is dangerous because we know there are 3 types of worms: round worm, thread worm, hookworm. So it can happen, it can go inside our body through vegetable, fruits. If we walk in barefoot, like this way it can attack us. So if while taking fruits and vegetables, we have to wash them clearly, and while walking we have to use our sandals or shoes so that we can prevent us from different kinds of worm. Now lesson 4, measles, tuberculosis, poliomyelitis and mumps. First, I'm going to talk about measles. This is a contagious viral disease. Mostly children under 5 years are the victims. The exposure time is 14 days. So within 14 days we can start to see the symptoms of measles, and the symptoms are the cold attack with runny nose and eyes, headache and swelling of face, high fever with rash. After recovery, one may attack by pneumonia, diarrhea, etc. So measles starts with runny nose and eyes, and there must be headache and swelling of face, and one can suffer from high fever with rash, and it can spread the whole body. After recovery, one may attack by pneumonia, diarrhea and various types of disease also. So in this condition, what we have to do? We have to take some steps. First, patient should be in separate room. Will not mix with the patient. The patient must be in separate room. We have to provide liquid food to the patient, and we have to ensure a clean environment, neat and clean environment for the patient. And if the condition, patient's condition is accurate, then we have to talk with our doctor. We have to take consultation with the doctor. Next disease is tuberculosis. Tuberculosis is dangerous contagious disease. The bacteria is called Mycobacterium tuberculosis. The bacteria which is behind this disease is Mycobacterium tuberculosis. And the symptoms of tuberculosis are: it starts with low-grade fever and cough. So tuberculosis starts with low-grade fever and cough. Loss of appetite with weight loss. Long time dry cough coming out with blood. So if we find these symptoms, we need to be careful about tuberculosis. So what we have to do, if we find any symptom of the given, we have to immediately consult with our doctor, and complete rest along with nutritious food. We have to take complete rest, and we have to take nutritious food, and proper arrangement of neat and clean environment. We have to ensure a neat and clean environment for the patient. Next, Poliomyelitis, children of less than 10 years are mostly the victims. The incubation period is 7 to 10 days. So within 7 to 10 days, the symptoms of poliomyelitis started to show. The symptoms are cold, cough, and headache. Headache increases after 3 to 5 days. Paralysis of hand and leg. So this disease starts with cough, cold, and headache, and after 3 to 5 days the headache increases. It turns to acute situation, and sometimes hand and leg used to paralyze. So to prevent this disease, 4 doses of polio vaccine can protect from this disease. And next one is mumps. It is a viral contagious disease. Children of 5 to 15 years are mostly affected. So who are mostly affected by this disease? Children of 5 to 15 years old. It is a common disease in winter. The exposure time is 2 to 3 weeks. So within 2 to 3 weeks, the symptoms of mumps started to show. And the symptoms are, it starts with fever, neck and ear are swollen, accompanied by pain which spreads in the mouth. So the symptoms starts with fever. One may suffer from fever, then neck and ear started to swollen, and it becomes painful, and the pain spreads into the mouth, and it becomes difficult for the patient to open the mouth. And in this situation, what we have to do, or what the patient have to do, first the patient must have to take liquid food. Liquid food is ideal for the patient, and gargling with lukewarm saline water is necessary. So if anyone feels pain in throat, then it will be helpful to gargle with lukewarm saline water. Now at last I am going to talk about lesson 5, immunization, vaccine, injection. Prevention is better than cure. This is well-known proverb. Prevention is better than cure. It is easier and less expensive than treatment. The main objective of vaccination is to reduce infant mental mortality. Mental mortality. The following disease can be prevented through EPI. So the following are BCG vaccine, OPV vaccine, pentavalent vaccine, vaccine for measles, TT. First, I am going to discuss about BCG vaccine. This is for tuberculosis. That means BCG vaccine is for tuberculosis. After 2 weeks of vaccination, the place becomes red with swelling. This vaccine is applied after birth. So BCG vaccine is applied after child's birth. Next, OPV vaccine. OPV vaccine means oral polio vaccine. It prevents poliomyelitis. This is applied in 4 doses. It starts within 6 weeks after birth, following the second one after 28 days, with the third one again after 28 days. Both dose is given at the age of 9 months. Next, pentavalent vaccine. This is a combination of 5 vaccines, and which covers diphtheria, whooping cough, tetanus, hepatitis B, and Haemophilus influenza B. So all these are the combination of pentavalent vaccine. And next, vaccine for measles. This vaccine is applied for 9 months baby which prevents from measles. And at last, TT. TT means tetanus toxoid. TT is a protection from tetanus. All women from the age of 15 to 49 and children who had convulsion after DPT or pentavalent need this vaccine. Students, here shortly I have discussed about chapter 5, lesson 1 to 5. Now I am providing your homework. Your homework will be 5 KBQ or knowledge based question, and don't forget to write the lecture number and homework number at the top of the corner of your copy. Our lecture number is 9 and homework number is 7. students, please read the text again at home and don't forget to do your homework. You have to submit your homework on every Saturday. That's all for today. Hope you have understood today's topic. Keep practicing at home and abide by your parents. Stay well and see you again. Till then, Allah Hafiz. Assalamu alaikum.